moment is upon us. I'm finally here to see Dr. Lee, and I hope she can help me with my condition, at least telling me exactly, what it is. It's just embarrassing. It irritates me, and I still struggle with the anxiety of being around other people with this on my face. Thanks for going through this whole thing with me.
I'm excited to see what she can do.
I want to set an example for my son that I can still get back full force to the old Eddie. I am nervous. My biggest fear is that she can't help me with my condition that I have and that I won't move forward in life. So...
Hello.
Hi.
Hi, how are you?
I'm good, how are you?
Nice to meet you both. I'm
Nice to
Dr.
meet
Lee,
you.
welcome. You must be the patient, Eddie.
Yes.
And you are?
Adrian, I'm his son.
Nice to meet you.
Nice to meet you, too.
You are here, I guess, because of this birthmark, really, right? Is that what you call it,
That's what
too?
it started out as when I was
Yeah,
born.
you were born with it? Okay.
Yeah, but it just keeps getting bigger, and over time, this all came up.
It got bumpy?
Yeah,
Okay.
real bad. It's embarrassing.
Right. And it stops right in the midline. It looks like it's not on the other side as well, right?
No.
Okay. I think what you have here is what's called a port wine stain. The other term for that is nevus flammeus. But what's very typical of this and what clues me into this diagnosis is the fact that you had it since birth and that it's bumpy or even warty. And the other clue is that it is on one side. But I think I should take a look at it first, if you don't mind.
Yeah.
Okay? A port wine stain is a capillary malformation. Essentially, it's like a vascular birthmark and is called a port wine stain because it's that color of port wine. So this is definitely a port wine stain. A lot of the times with these port wine is you get this purple color, which kind of tells me too that the pigment or the growth may be a little deeper under there. And we got a few, like 3 little bumps here. Hopefully we can get rid of them and not have too much problems with bleeding. Having something this prominent, this noticeable in the center of your face can affect your ability to just function as a normal human being. So I feel for Eddie. Port wine stains are very difficult to treat. They are particularly stubborn. So hopefully we're gonna have an answer for him. There are things that you can try to remove a port wine stain, like laser treatments used to help lighten these vascular abnormalities, but they can take multiple treatments, and each treatment has a gradual improvement.
Yes.
And also, even if you get like 12 treatments, it's not guaranteed that the whole thing is completely gone.
Right.
That kind of thing. In terms of the bumpies, we can try to flatten that with other kind of techniques here. Hopefully they don't grow back. So one of the things is that this laser, it feels like the snap of a rubber band. So it's not like the most comfortable thing. So we'll see how you respond, okay? We'll get all set up for you.
Thank you very much. Oh, it feels great to have Dr. Lee actually get me a good answer to what it is.
We're ready for you.
All
We'll
right.
bring you inside.
All right. And wish me good luck, man. I can't wait to look in the mirror and it's not there. If she can help improve this, I'll just be grateful to her.
These bumps on Eddie's nose are raised collections of vascular abnormalities. This growth that's sticking up is not so firm, it's a little more wobbly. So sometimes if I just take a scissor that has a little serration in it, it'll help to grip it so I can snip it. All right, ready? You're gonna hear a little buzzing noise.
Okay.
Open your eyes. You do see that thing sticking out of the corner of your eye anymore?
No, I don't.
It's pretty good.
Yeah, that's awesome. There's no bump when I look to my left. No bump at all. I don't see anything. And it's great.
You wanna take a look?
Yeah.
It's just a little swollen because you put numbing, okay?
Oh my gosh.
So now I'm gonna treat this majority here. I'm not gonna treat your eye right now because I don't have the shield that you need to go in there to protect it. And remember, it's gonna look worse there,
That's
which is
normal.
why I wanted to show you this first. On Eddie, I'm gonna use my pulse dye laser. And this is my favorite kind of laser. For redness, it's like the best, most definitive way to treat this. So I love my laser, I treat it with respect. 12 millimeter, 1.5.
This type of procedure, even though it's great, it doesn't feel too great. So Eddie's not gonna like me so much when I come at him with the snap of a rubber band and you're supposed to stay still. It's a tough thing to endure. And he's gonna need multiple treatments.
I'm gonna do one treatment right here, okay? Everybody's got their glasses on? Okay, 1, 2, 3. How you doing, okay?
Yeah, I'm good.
Oh, look at you, tough guy. Okay, ready? Gonna do a few more. Probably will feel better over there because it's numb.
I'm really trying to give Eddie a great treatment, but I am going to avoid the eye area because I don't have the proper corneal shields to protect his eyeball. This laser, if we treat the eyelid skin, it could penetrate through that thin skin to his eyeball and could cause blindness.
I can see that it's darkened a little bit, which is good. That's what we want.
Okay.
What the laser is trying to do is it's targeting redness, and so when it does that and it pulverizes those little blood vessels, that causes ecchymosis or bruising of the area. But in this case, it's a good thing. It tells you it's working, yes.
Let me show you. See how you bruise a little bit more right there?
Yeah.
We treated this area and it's having a purpuric response, which is what we want, this kind of bruising response. You're going to see that it's going to be like purple like this for the next 1 to 2 weeks.
Okay. I'm very excited about the possibility of what's going to happen with the discoloration. I mean, the bumps will be gone and the discoloration will be better.
You know that this takes multiple treatments,
Right.
and this is the extent of what I can do for you. And so I'm gonna bring in a laser expert. She has more of the capacity to treat over your eye.
I'm gonna send Eddie to one of the best laser specialists, Dr. Arisa Ortiz in San Diego. She's got so many different kind of lasers at her fingertips, and she can make a significant difference in fewer treatments for him.
All right. I appreciate it.
Thank you.
Thank you.
It was really nice to meet you.
Nice to meet you, too. I'm just floored at the results. This is definitely going to help with my anxiety. I'm bound and determined to get back in there in the workforce, and this is really going to help give me the jump start that I needed to do so. It's been a great journey, and I'm ready for a new beginning. This is Eddie 2.0. After my initial procedure with Dr. Lee, she referred me to an expert in San Diego.
Hi, nice
Nice
to
to
meet
meet
you.
you.
I'm Dr. Ortiz. Go ahead and lean back.
Dr. Ortiz was great. She did several more laser sessions on my birthmark.
All right.
The last one that I had was about a month ago, and I'm just so thrilled. It healed up nicely. It blows my mind. The dark red is gone, the bumps are gone. I look in the mirror more now just to see it. Before I had the procedure, the anxiety was extremely bad. It's like I was a prisoner in my own house. And now I've even started interviewing for jobs again.
Tell me a little bit about yourself there, Eddie.
I was very good at raising sales. I'm very confident, and I know that I have a lot to bring to the table. You ready? Hang on. Emotionally, I'm a very different person. I'm back to my old self. I find happiness in doing things with my family. So you enjoying that place that you're working at?
Yeah, I love it, actually.
And I'm indebted to them for the support that they've given me throughout this whole journey. Dr. Lee has completely changed my life, not just aesthetically, but also emotionally. I can never thank her enough for what she's done for me.